Good afternoon, everyone. We're back with our regular afternoon update. Chairman Rand and I are alternating on this so we can try to keep a fresh face in front of everyone and make sure they know that every day's information is going to be a little bit different. I was thinking today, and this will only take a second, it won't go very long, but we always start our council meetings with a moment of silent prayer or silent reflection, and it just helps everybody have an opportunity to take a deep breath and get ready for doing business. So it won't be extended, but I would just like to start today by just taking a moment for all of us to take a deep breath and contemplate. So we want to thank everyone for being here again today, and those who are taking their time out of their schedule to participate and listen in these informational briefs. Maybe a good reminder for today. We're trying to constantly put things into people's mind to refresh, but calm is contagious, and it's important for people to know that just like other situations, if you're calm and you present a calm demeanor when you're in a situation, it is contagious, and it has a really good effect on others to be calm as well. We want to start by talking and thanking all the employees in healthcare and public safety, our first responders in the community who are doing a whole lot of work under a lot of very stressful circumstances. And I know this is going on around the clock. We want to make sure that they know how much this entire community appreciates all the sacrifices they're making for the health, safety, and welfare of the rest of us. And it's important for us to take a minute and thank the members of the public who've made changes in their daily life and their daily routine because they understand the importance of these messages. They understand how serious this situation really is. For those who are thinking that this might have been an overreaction, I think that it's finally starting to sink in that this is very, very serious, and the actions that are being taken hopefully will preclude a lot of the really bad impacts that other communities are seeing from happening here. We want to also recognize that some of our residents are returning from spring break because most of the schools are closing. So we want to make sure that we reinforce the importance of safety in the health checks that we have in terms of social distancing and washing your hands and so on. There's also a number of people that may be working their way back home from winter in warmer climates. So we want to make sure that nobody is living in that big of a bubble that they don't understand what's happening, but we just want to reinforce that there are people coming back into the community, and we want us all to be aware of that and help them. We need to continue to be vigilant, social distancing, self-monitoring. If you're sick, please stay home. Monitor your symptoms. Try to just go out if you have essential needs, if you need to get food or medications or so on. But the more we can minimize that type of movement within the community, hopefully the better off we'll be. We do know it's an ever-changing situation. We would advise everybody to continue to follow the Peoria City County Health Department website for the most recent updates and local information, or also you can call 211 if you have questions or concerns. Folks, this is really a tough time that we're going through. I've been on a lot of phone calls in the last couple days from elected officials and government officials throughout the country. And I really feel comfortable in saying our community is doing a good job on this. I think we can do a better job. We don't know. It very well may get a bit tougher for us. There may be a few more restrictions put on. We don't know that. We're going to be prepared for it if it happens. But the most we can stay focused and continue to follow these safety measures that everybody is aware of now. Please do them. Don't Don't just say that's getting old, I don't need to do it anymore. Be vigilant, encourage others to do that. Stay strong. We just need to make right choices. We need to continue to verbalize with others the importance of why we're doing this and how important it is that we're safe. We need to make sure that we keep those people that are the most vulnerable to this as safe as they can be and distance as far as they can be from the rest of us. And just stay strong. Look out for each other, care for each other, and we'll get through this all. So now I would like to introduce Monica Hendrickson, who is doing unbelievable work here at the Peoria City County Health Department with some updates from her end. Monica?
Thank you, Mayor Artis. With our usual briefing, I'll start with the announcement of our current cases in our Tri-County region, that is the Peoria, Tazewell, and Woodford region. To date, we have 5 positive cases in the Tri-County region, 33 negative cases, and we have currently 22 pending cases. Again, that's to date for the Woodford, Tazewell, and Peoria areas. This afternoon, the governor announced 3 additional deaths in Illinois related to coronavirus, and this continues our conversation about the importance of understanding those non-pharmaceutical interventions that play a huge part. I think Mayor Artis said it well with understanding that we may need to do further restrictions and understand that we may have even more challenges ahead of us in the days to come, but really it starts with understanding our mindset as a community. We've gotten a lot of questions regarding an understanding between these 3 kind of terms, and as we are transitioning within our response, how that might impact our community. So we have some brief slides to kind of go over our response as a community. So just to, again, highlight the fact, isolation are individuals who are sick. They have symptoms, and this is regardless if testing is or is not completed. So if you are sick without a positive test, we still want you to self-isolate. That means stay away from others, contain yourself, really try to minimize exposure and transmission of the virus. Quarantine are for those individuals who may have been exposed. And we are really wanting to have them, again, do the same type of habits or behaviors that you would for isolation, but during quarantine, it's during a period where you may still get the virus. It's that incubation period. And for COVID-19, that's about 14 days. So for 14 days, if you've been exposed, we ask people, while they still have no symptoms, to self-quarantine. Again, trying to keep away from others, stay away, decrease transmission. Self-distancing is really kind of an overarching idea for our general public, which is really to increase the space or distance to avoid transmission. Think about it as making it harder for the virus to get to each other. So this is kind of a little bit of a way to think of it. Isolation, you are sick. An individual is sick. Those symptoms include a fever, cough, and shortness of breath. Quarantine for 14 days. This is when you are exposed but have no symptoms. So 14 days, we ask you that you've been exposed, you're to an individual that's sick, but you have no symptoms. You quarantine for those 14 days. Now, during quarantine, if you start to get symptoms, you then transition from going to quarantine to self-isolation because now you are sick with a fever, cough, shortness of breath. So now you're no longer in quarantine, you're actually in isolation. So you yourself are transitioning from that one phase to another. So what this means in terms of social distancing is that without social distancing, when an individual gets sick, they are transmitting the virus to other individuals who then will either quarantine or not. They will transition, they will get sick, they keep passing it on further and further, and you have vulnerable populations where this virus can lead to fatality. Why social distancing matters is because it creates that space. It creates that gap that prevents even those that are sick and that have or were exposed, that transition to being ill, to really prevent them from further taking that virus to the next individual. That's why social distancing is really important. We talk about comorbidity a lot in this discussion about those vulnerable populations. And a lot of times we refer to things such as age range, heart disease, respiratory health. But to give you some values, in the Tri-County region of Peoria, Tazewell, and Woodford counties, there are close to 59,000 people that are 65 and older, which is definitely a vulnerable population for this. In 2017 alone, the hospitals did over 1,500 treated cases of heart failure. Those are individuals that would be very much impacted if they were to come down with the virus. Anywhere from 11 to 18% of our residents in the Tri-County have asthma, another comorbidity related to this. So just think about the effects of the virus to that 11 to 18%. That's anywhere from 1 in 10 to 2 in 10. That's a huge range of our population. And in fact, we have in 1 year over 800 cases of COPD. Again, another comorbidity that having this virus would be very detrimental to their health. And then diabetes. Anywhere from 6 to 10% of our population has diabetes. And again, there's about over 900 inpatient cases in 2017 that were related to type 2 and type 1 diabetes. So when we think about this virus, it's more than just the individual. It's those numbers plus more that live in our community, are part, active members that we are trying to protect. And that is why things such as making sure if you are sick, you are self-isolating, that if you have been exposed, that you are self-quarantining, and most importantly, the idea of social distancing and those other non-pharmaceutical interventions. So what we should be doing is, again, we want to follow all of those three ideas. We want to practice good hygiene that includes washing your hands, covering your coughs, and most importantly, we want to change the mindset of our community. We need to make sure we are now going from the behavior of not to if you have been exposed, not when or whether you have been exposed. To change the fact that you should really start practicing behaviors as if you have been exposed. And what does that mean to those thousands in our community that having COVID-19 would be very much a burden on them? So those are really the things I wanted to share in terms of when we're talking about the importance of that mindset as well as social distancing, talking about what are essential services and making sure we practice that. With that also comes the fact that Illinois Department of Public Health has further looked at prioritizing testing. This is done twofold. We talked about this a little bit yesterday, but one is that as more and more of our private lab testings are coming on board in the next few weeks, the Illinois Department of Public Health will be focusing on their testing on really specific populations. Those that are in long-term care facilities, skilled nursing homes, anything that's congregate living. And the reason why we want to focus on these types of populations, as well as those that are hospitalized with pneumonia, is because testing matters in their treatment. For most individuals, getting tested will not change the course of their treatment in terms of COVID-19. Most individuals, again, 80%, can stay home, will have mild illnesses, and need to self-isolate, take their medications that are fever-reducing, rest, and hydrate. But for that high vulnerable population that are in those type of settings, knowing their test changes their treatment trajectory. And so we want to make sure that it can help guide care, and testing will be prioritized for those individuals. This is something that as a community we're going to need to get a little bit more used to, the idea that we need to have these prioritizations. And included in those prioritization is regards to our EMS services. So I'd like to introduce Dr. Ashley Huff. She is the EMS Medical Director for Unity Point Health.
Good afternoon. I'm Dr. Ashley Huff. I'm the EMS Medical Director for Unity Point Health EMS. I'm also an emergency physician at Unity Point Health Proctor. I'm here today to talk a little bit about what we're doing in our emergency departments in the area, as well as what EMS is doing to get ready for COVID-19. We've changed our policies and procedures in the ERs. For any of you who have been there recently, you know that we no longer are allowing visitors. It's important for everyone to know that we are not doing elective testing for COVID-19 in our emergency departments. Only patients who meet the very specific criteria or who are so sick that they need to be admitted to the hospital and also are approved by the public health department are going to be tested. If you feel that you may have symptoms consistent with COVID-19, please call your doctor or the nurse call line to discuss it with them, unless you feel that you're having an emergency, in which case you can always come to the emergency department or call 911. The other thing we want to say about the emergency departments is we're trying to keep our rooms as open as possible to be available for all of the patients in our community who may need it. Our vulnerable population may be becoming very sick from COVID-19 as it moves more into our community, and so we won't be doing things like work notes and some of those visits nearly as much as we used to. So if you need a work note, please contact your primary care provider or an urgent care, or even better, see if your employer would possibly be willing to address their policies to not require work notes at this time. As far as EMS is concerned, we are working very hard to prepare our EMS providers to give them the appropriate PPE to go out and treat their patients and stay safe while doing so. Right now, we are also implementing protocols that will allow them to go out and evaluate patients who are having an emergency, and potentially also recommend that patient stay home after a thorough evaluation if the patient meets specific criteria that determines that they would be safe to stay home and treat themselves. So if you feel like you're having an emergency, you can call 911. If you just feel like you're sick, please call your doctor first, as our 911 and emergency services are going to be very strained as we address this virus.
So with that, we'll open up to questions from our audience.
We have one more case locally, and I understand it's in Woodford County.
Yes.
Is it related to the first case in Woodford County?
I don't know the details. We can reach out to Woodford County, but I know they were working on various contacts related to cases, as well as some others that were coming in.
Okay. And then when you talked about more testing, did you say that we were going to have private labs coming online and there was going to be more testing available? Are you seeing that on the horizon?
The state is seeing that in the horizon. The limiting agents still exist in terms of just sample collection. But as Dr. Huff mentioned, as well as Dr. Stoner, who's available to answer questions, we are still prioritizing to make sure that testing is for those where testing makes a difference. And so there are more labs that are privately that are coming online. At the same time, the state lab, which has been up and running, actually the state of Illinois being the first to up and run their state labs, they are the ones that are going to be much more prioritizing their levels.
Okay. But I mean, we will start seeing more testing. So like you talked about with the nursing homes, we will be able to monitor our nursing homes better, which are, the places that seem to be getting hit the hardest.
And I think that's the idea behind the prioritization. So the question being that if we are able to prioritize nursing homes, then we're able to monitor them more so. And that's really the idea behind why Illinois Department of Public Health is pushing for that prioritization of testing.
Do you have any idea when we're going to start getting more testing?
I hope soon. I think we all hope soon. But understanding that every day we're learning more and more labs that are getting onboarded, getting validated, because again, we want to make sure that the tests are approved through the right processes with the FDA and validated so we don't have false positives and false negatives, which means that we want to make sure that they are sound in the decision-making process. And so with that, it's time-consuming to go through those tests, but the effect of them or the outcome of having valid tests like that means that we're able to better address this virus.
Do we know the age or sex of this new case?
No, I do not.
Can we actually get a breakdown again of the counties now that have it in the Tri-County area?
So it's really, there's 2 cases in Woodford County to date and 3 cases in Peoria County, and 0 in Tazewell for your positives.
Can we talk for a second about PPE availability? I know the Illinois Health Association put out a plea asking for, anywhere out there that has, face masks, gloves, any supplies to, we need to start gathering these up. So if there's like dentists that have closed their offices recently, for instance, if they have any spare around. Can we talk a little bit about PPE supply here in the area?
I think it's a great question, and Dr. Huff, I know, can answer it too in her role. The requests are coming in full force. We are in our community are actually coordinating that between our two emergency management agencies, the city's Office of Emergency Management and the county's Emergency Management Agency. And the idea that this question around PPE and how we can make sure that we have supplies is that we are trying to coordinate it through these levels and then request it through the state and the national stockpiles. But you're right, it is getting to the point where we are asking as much as we can around community partners that are closing down shops, such as dentists or some places that do elective procedures, to bring in the supplies to our first responders. They are a priority, which makes it really important for what Dr. Huff said, which is when to use your first responders. And that be aware that they will be prioritizing those calls because they want to not only control the capacity in our emergency departments, but also the capacity of their PPE as well.
So at this point, would you be putting out a plea to dentists and other healthcare providers who do elective services to, is there a place they can come forward to say, hey, I have this, like, here it is?
Yeah, we've actually had a lot in our community in terms of those places such as dentists and other providers that are not using their current PPE because of closures, wanting to request it. And for those of you who are aware that requests for volunteers as well as products can actually go through 211. They've set that up to create donations throughout the community. And based on what we're receiving, we are sending them back out to our providers.
I have a question for Ms. Huff.
Dr. Huff? Oh.
Before we go, sorry, can I get a breakdown of the pending tests in the area? Do you know that?
I don't have that with me, but it is, I believe Peoria County has 13 of the ones that were listed, and then I think, don't hold me to it, but I can get it back to you. I can have a breakdown, but I believe it's 3 were Woodford County and the rest were Tazewell.
What's that total figure again? I'm sorry.
33.
33. Okay. But that's still not, that's not confirmed. That's good.
Yeah, you asked for negatives, right? Correct? Or
I asked for
oh, pending. Oh, sorry. Pending is 22,
22.
and I can get the breakdown of those
Okay.
for the.
22.
And I think it's something to understand that the pending task, that number is going to start changing because of the prioritization aspects as well. Again, in terms of, I think it's going to maybe stay about the same, but not necessarily they're going to be, again, focused testing to those high priority groups that we're looking at. So earlier on when we thought we had more testing available, I think there was some testing that might have been done earlier that in today's criteria we would not test for necessarily. So let me get you Dr. Ashley.
Can you one more time just rehash? Tell me who is a priority right now?
As far as patients go for the emergency departments? Or?
Yeah.
Yes. So the patients that we consider priority patients are ones with severe difficulty breathing. If they're having chest pain, if they don't feel that they are strong enough to stand up, walk around, take care of themselves at home. A lot of these patients are going to fall into that vulnerable category of patients who are elderly or who have other health problems. They're going to make them get much sicker from this virus than the rest of us.
But they don't necessarily have to be older, correct?
Not necessarily. You can have a lot of health problems, lung issues, lung disease, heart disease, and be fairly young too.
And they will still be prioritized?
Correct. Yes.
You said policies and procedures were being put in place to protect workers and patients. Can you talk a little bit about what is being changed and looked at as far as protecting both?
Sure. So one of the things was we're not allowing any visitors anymore. So people come into the emergency department. If they're an adult patient, they come in and they're taken to their own room, but we're not having other people in the department with them to try to limit the spread of the virus. Our PPE in the hospital has also changed. So anybody who has fever, a cough, influenza-like illness, we are approaching their evaluation as if they could have COVID-19 because we want to make sure that our staff are protected from catching it themselves so they don't spread it. We also want to make sure that our other patients are protected.
Can you describe those changes specifically? So if I have a patient with flu-like symptoms, am I wearing face mask? What am I wearing now that I wasn't before?
Sure. So, we look at droplet precautions for PPE. So if a patient with an influenza-like illness, we're going to put on a gown or gloves, a mask, and goggles. And that's to make sure that if the patient, is coughing or there's droplets in the air, that we don't get infected by them. Yes.
We discussed testing this year. I'm not sure if you can speak to this. How testing now has gone into the private labs, beyond the state labs. There is a cost. Do we know the actual cost to patient or the actual per unit cost of these new private lab tests?
I really don't know, and I think what I would emphasize on those is there's a lot of interest right now in people wanting to be tested. We have a lot of other viruses in the community. I'm getting positive influenza tests back every day. There's a lot of other viruses. RSV is big right now. It's RSV season. There's a lot of other things you could have besides COVID-19. So if you're healthy, and you're doing well and you're able to take care of yourself, knowing that you have COVID-19 versus another virus doesn't necessarily change medical management. We would still recommend you take your cold medications. I'm sorry. You still recommend you take your cold medicines and just get better. Yes.
Those at-risk groups that have to be tested under your policies, should they be worried about this might be a bit, could this be a couple $100 they have to worry about, or are they going to be affected by some other cover? I'm just curious.
I honestly don't know at this time.
I have a question for Mayor Artis. So earlier, I know you said that you were on the phone with elected officials, government officials from around the country, and then you said that you wanted to say that you think we're doing a good job. How are those two things connected? Are other people just doing worse? How do you know that we're doing good right now?
And it's, again, not to call any specific community out, but from a couple of these calls are nationwide calls. So just from some of the questions from some of the other communities that are things that we're just way beyond, and they're just asking how they ramp up in to do that. And so it's not as much to say these communities are bad. It's to reassure people that we feel like we're in a good place in terms of responding accurately, getting. I think we're doing a great job of getting as much information out to the people in our community as we can. Everybody really wants a lot of information on this, and we want to give it to them. And in terms of some of the emergency preparedness that Monica and the EMS folks are doing behind the scenes, I just want to try to extend the confidence that I see in them and what they're doing, getting that job accomplished, and the confidence that we have in them to get that done.
With all these new guidelines, some places remain open in Peoria, including salons, gyms, stuff like that, under state law to remain open. In that case, you're mentioning these guidelines. Do you want Peorians to still visit places that aren't essential for living?
So this is me. I wouldn't go anywhere like that in public that there was going to be anybody. I mean, and I think the sooner that people get that mindset, why would you even want to take that chance? If you walked through a peroxide shower to get into a business that you didn't necessarily have to go into, why would you? And so that's all we're trying to say is there may be a time in the not too distant future where we don't have a choice on that. If people don't work really hard to try to keep this thing under control, those type of emergency measures are going to be put on us. So I think it's really important for people to say there is no reason for me to take that chance to either expose myself or to potentially expose somebody to something that I may be carrying as well.
So bars and restaurants no longer have the dine-in option. You just have to use drive-throughs or curbside service. Do you have any reason or any knowledge or thought as to why that is the way it is, yet people are still going to hair salons and nail shops, and that's direct touch. You're directly touching somebody's hand to do their nails. You're directly touching somebody's head to do their hair. Why is it that those places would still be open right now?
I can only speculate, so it doesn't really do any good for me to speculate on why they may or may not. I think that people are doing a very good job of minimizing or eliminating any potential for that type of contact. And a lot of the businesses that have to perform that service, they don't want to subject their employees to that type of contact either.
Would you ever consider calling a shelter in place in Peoria?
Yes, I would, and as proactive as our state has been, I don't think that is going to happen. But certainly, if we felt that we needed to take that measure ahead of the state, and it wouldn't be on my call alone, Monica and the other EMS folks, it would be a conscientious decision about, I mean, that's a pretty important decision to make. But we have to be ready to make that decision if the trained people think that that's what we need to do.
The governor has discussed it. Have you discussed it in your meetings, or it's sort of kind of more a thing in the future?
We all know it's out there, and I have no knowledge of plans that the governor has to do that. If he wants to do it, I know it's a contingency. It has to be. Okay.
Okay, with that, without any additional questions, thank you all, and we will see you tomorrow again here at 4 o'clock.